Samin is logged on, but we are going to miss seeing her today.
Yeah, no problem, no problem.
She's been through a major crisis and a trauma in her life. And here I see Dr. Hasib Jafri.
Yeah.
Dr. Hasib, can you hear me, Dr. Hasib? Hello, Anita. Hi.
Oh, very good evening, ma'am.
Good evening.
Good evening.
So you're ready to take over, Dr. Jafri? 1 minute to go.
Yes. So, welcome to all the esteemed audience and members of the DOBARA family and the extended DOBARA family at Instagram, Facebook, LinkedIn, and all the other places. Today I'm going to host the show due to the unfortunate.
Hasib, your voice is drifting away. You have to come closer.
But this is a long drawn plan and a much debated one between the organizing committee. And today we have Dr. Ashank Mishra with us. So just wanted to check if we are good to go. We are at 6 so far. Ashank is there with us. We have 15 participants, and we are also not going to think with them.
Hasib, you are not audible, Hasib.
Hasib Jafri, you're not audible. I see so many names from all over the world. Welcome everyone to DOBARA, to this amazing session given to us by Dr. Ashank Mishra.
Hello.
Ajra. So would you like to do Dr. Mishra's introduction, Hasib?
Are you able to hear me?
Yes.
Hello. Are you able to hear me?
Yeah, yeah,
Yes.
yeah.
It's better.
Hello.
Yes, it's clear.
Yeah. So today we have Dr. Ashank Mishra with us, and Dr. Ashank Mishra is a renowned dentist from Hyderabad, and he is currently the visiting professor for Department of Periodontology and Research at in EIMI Malta. He is also an MDS from Dr. NTR University of Health Sciences. He has also been a university topper in his undergraduate course of dentist. He has previously worked with as an assistant professor in dental school of Hyderabad. Sciences. He's also been a university university.
Your connection is poor, I think.
University.
Hasib Jafri, your connection is very poor, I think. Shall we get on to Dr. Ashank Mishra and you start, Dr. Mishra?
Yeah, yeah, that's what. I hope my voice is very clear.
You're very clear.
Okay, fine.
Excellent.
Fine, no issue. Fine.
University topper in his undergraduate course of dentist. As an assistant professor, obtained his master's in laser dentistry and also has an associate.
It's okay, Hasib. Let Dr. Mishra take over.
Okay.
Thank you.
Yeah. Okay. Fine. Fine. Good afternoon to everyone who are in European countries, because here in Asia and India, it's a good evening. So I will first of all thank all of you to spare time for the following presentation, and I would like to start with few of the myths which we could get from the people or from the audience. There are a lot of people who have messaged us, mailed us regarding some myths. So I would like to just demystify a few of them, and then we have an open platform for discussion if you further need some information from me regarding the same. I'll share the screen now. Is my screen visible?
Yes. Yes, it is.
Okay, fine. Fine. So now, demystifying the most common dental myths, let us enlighten you all with the facts, right? I am Dr. Ashank Mishra. I am a visiting professor in European Institute for Medical Studies, Malta. I have my few team members also in the room. Thank you all for visiting here. A few of my students are also here.
Oh, well, lovely.
So it is unanimously acknowledged that most of the people, I should say almost. Now, what exactly is the problem of the patients is whenever they come for a dental treatment is always a nerve-wracking experience for them. Perhaps this is the reason behind rescheduling our prefix 6 months appointments. Because whenever there is a chance that you have a dental appointment, patients or individuals are skeptic about it. So that because there's a lot of stress and anxiety which surrounds your mind before a dental checkup, and that is what gives birth to a lot of dental myths, which increases our dental woes, right? So we move on to the first and a very common myth which you all are aware of. The myth is sugar the main culprit causing the cavities? Is it only the sugar which causes the cavity? Is it a main culprit? No. See, sugar is not the only cause for causing cavities. There are a lot of other reasons which can cause cavities. It could be a dry mouth. It could be an acid reflux. You understand what an acid reflux is? I will try to talk in a very simple language, but still if doesn't understand, just you can put a message on the chat box. So acid reflux is some people have got a gastric problem where they get an acid regurgitations. So even that causes a lot of acid secretion into your saliva, into your mouth, which causes decay, which causes the wasting disease of the teeth. Sometimes even lack of fluoride. So there are individuals who come across toothpaste which do not contain fluoride. So lack of fluoride is also one of the major sources for not getting your teeth into health and maybe causing a lot of cavities. So dry mouth, lack of fluoride, lack of hygiene, especially lack of oral hygiene, also one of the primary cause for causing cavities. Now, when we talk about cavities, then there is one more myth which is additional to that is many people during ancient times, or maybe few people all over, maybe in some rural areas, also believe that cavities are caused by worms. Cavities are not caused by worms as such, because the modern dentistry has established and has already given evidence that it is not a worms, it is the organisms which causes cavity. It is the bacteria which causes the cavity. Actually, what causes the cavity is called as the dental plaque. We call this technically as a plaque. Plaque is a group of bacteria. So these bacteria will cause a cavity. Now, how do they cause a cavity? I will just explain in a very, very brief nutshell. Now, what happens is you have got a bacteria. So these bacteria will be waiting for the sugars to be taken by an individual. The moment you take sugars, the moment you take carbs, these bacteria will attack, because these sugars or carbs are the food for the bacteria. So they attack that and then they convert it into acid. And that acid damages or creates a hole, which is called as the dental cavity, which is called as a dental caries or a dental decay. I hope I'm clear. So sugar is the main culprit causing cavities is absolutely wrong. It's sticky substances, it's carbs, carbohydrates, and a lot of many things which are contributing to the cavity. It's also your saliva, which is there in your mouth, also plays a very important role in causing the cavity. We move on to the second myth. The second myth says gum disease is not very common. So there are a lot of people I have heard, a lot of patients I have heard. So it's not common, right? Gum disease is not very common. But yes, it is. It is actually, I should say, the commonest disease in the whole globe. You will not believe that 90% of the globe, of the world population, suffers from gum disease. Gum disease, which is called as gingivitis, that means infection of your gums. It is called gingivitis, which is all over world prevalent. Now, you may ask me, how do you know that you have gum disease, right? So when you would have observed sometimes slight bleeding while brushing. Maybe you would have observed, maybe when you spit after brushing, there's a slight speck of blood. Maybe there is no bleeding, but you can see that one or two areas of your gums are reddish in nature. Those are the initial signs of gum disease, which is 90%. And you all should be aware of that. So that is why gum disease for every patient doesn't give you a symptom. It is what you observe. So it is bleeding gums, which is not normal. So we have to understand the third myth, which is continuation of that bleeding gums is not normal. So bleeding gums will be observed, and whenever we ask someone that you have bleeding gums, no, but yeah, sometimes during brushing, I just notice once or twice. Yeah, it's occasional. So they take it very, very casual. Yeah, it happens sometimes, but it's okay. Because it happens sometimes, because it happens from a small area, they take it very casual. But they don't know that they fall under category of gingivitis. So bleeding gums is not at all normal. I don't say that every time bleeding gums is a disease. Bleeding gums can also happen if you buy a new brush, a very hard bristles brush, and start brushing aggressively. Yes, bleeding can happen at that point of time. So I don't say that, but then occasionally also if you are able to find that there is bleeding during brushing, sometimes even small specks of bleeding is also there, but they need to be very careful in such conditions because you are an established case of gum disease and you need to get your checkup done. So bleeding gums is not normal. Don't take it casually, and you have to go for a dental checkup for that. Okay, so it is something which is very important, and I said 60% nearly in the world experience bleeding gums. Can you imagine? 60% of the world, more than half of the globe, and 1 in 3 people, as I said, think that bleeding gums are normal. Okay, so bleeding gums, red gingiva or red gums, sometimes bad breath, sometimes swollen gums. Or sometimes you may see that receding gums. Sometimes you may see that the teeth are looking longer because gums are going down. The gums are receding, which happens with age. I'll talk about age changes with mouth and teeth and gum diseases in my next session when I have next week. But then as of now, these are all the gum related issues which are noticed and they're not normal. So you need to be very alert considering these things if you are really facing them. Okay, next important thing is you need to brush after every meal to keep your tooth fine. Many people tell, or maybe many parents will instruct their children. I have seen many people telling them, no, after every meal you have to brush. Then only your mouth will be healthy. I continue one more myth with that increased duration of brushing is better for health. So it's a very common myth that people say that, no, I have brushed five minutes today morning and 5 minutes in the night. And I'm brushing nearly 4 to 5 minutes. And then it's not possible I have a gum disease. So mind you that if you brush 5 minutes, 6 minutes, 10 minutes, it is not going to help you. First thing. Second thing, brushing after every meal is also not going to help you. It is always 2 into 2. The formula is 2 into 2. Not more than 2 minutes. 1 to 2 minutes is ideal. This is according to the American Dental Association as well, ADA. 2 times per day is more than sufficient for you to maintain your good oral hygiene. So there is no need to brush for a longer duration just because you feel that the more good or the more long I brush, the more better I can remove the bacteria. It's a misconception again. And increased duration of brushing is not going to help you. And what you can do is just after every meal, if you just rinse your mouth or gargle with a normal water, not even, I don't even recommend salt water, just a regular clean water, that's more than sufficient. 2 times brushing, once in the morning and once post dinner, is more than sufficient for you to maintain an excellent oral hygiene. Okay. Next. This is also very common. Hard tooth bristles or a very forceful brushing makes your teeth clean. Right. So actually speaking, When I talk about brushing hard, so brushing hard is basically a counterproductive. We call it as a counterproductive. So the more harder you brush, you lose or you traumatize more your tooth enamel and your gum tissue endure. So the more harder you brush, the more trauma to the teeth. How? Because the more harder you brush, the more enamel, you all know what enamel is. Enamel is a layer which surrounds your tooth. So you lose that enamel layer and your gum tissue also starts receding. That means your gums start lowering down. Your teeth appears longer. The neck of your teeth starts appearing. Eventually, what comes? Receding gums and abrasions. Abrasions means you see, I'll just show you. You see something like this. You can see the picture. You can very clearly see that near the neck of the teeth, you can see V-shaped notches, right? Most of the people almost after middle age starts getting this type of lesions on your teeth. So, and one more thing very interesting is, if you are a right-hander individual, maybe when you brush from your right hand, just imagine, or maybe you will definitely understand that if you're a right-hander, you will brush more harder on left side or right side? On your left side. When you're a left-hander, you brush more harder on your right side. That is why with the moment we see these type of visions, we can tell you that, okay, you're a right-hander and then you are brushing very, very abrasively. So we don't recommend you to use a hard bristle. See, every company, I'm not representing any company today. Any company will have 3 or 4 types of bristles. You have a hard bristle, you have a medium, you have soft, you have ultra soft also. You have a sensitive bristle also. Don't go for hard bristles immediately, because bristles, when they're hard, you feel it is hard, it will clean hard, but then it leads to this type of problem. And you know what now when you look at the teeth, can you see that your teeth have become narrowed down? Half of your tooth is eaten away with your aggressive brushing. And what is the end result of this? Only one: extreme bad sensitivity of teeth, pain in the teeth. And you will have to come to a dentist. We will have to fill it, restore it, or maybe if it is too severe, maybe we have to do root canal treatment, which you all have heard about. So this is why we don't advise you to use a harder bristles brush or a very hard technique of brushing, because the technique of brushing is very, very important. Every dentist will advise you the technique of brushing based upon what technique is suitable for you. Everyone cannot have the same type of technique. There are various techniques based on age and based on the dental treatment you have undergone. Patients who are having braces treatment will have a different technique. Children have a different technique. Aging people have a different technique. Everyone has a different technique which a dentist will advise you or recommend you based upon your findings of your mouth or your teeth. Okay. Next. Interdental brushing creates spacing between the teeth. Interdental brushing, maybe if you know that there are small brushes which are available to clean between the teeth. And you all have heard about flossing. And then this is also a myth that flossing is not necessary, because I'm brushing twice a day. I don't need to floss. Because we are brushing so many times, I'm brushing twice, I'm using a mouthwash, so I don't need a floss, right? This is what is a myth. So this is what I'm talking to you about is interdental brush. This is what an interdental brush is. An interdental brush are the brushes which are advised to you, which are used to clean the gaps between your teeth if you have spacing between your teeth, recommended by a dentist. Don't go and purchase over the contour available interdental brushes. There are a lot of companies nowadays which give you a customized interdental brushes also. Something like this. You have got a brush like this. You can see there are various varieties of brushes. You can see a narrow brush. You can see a medium. You can see a narrow, wide. You have variety of brushes. So we recommend you, based upon the space you have between your teeth, you can select the brush and you can use it, because overzealous brushing of this sort of brushing is also not good and causes a detrimental effect on your teeth. This is what I'm talking to you regarding this flossing. Is flossing really necessary? Yes, it is necessary. But why is it necessary? Because you need to understand that floss, a dental floss, is a small thread-like structure which is available. You would have seen in most of the companies. This floss removes the bacteria which is there between your teeth. You can see in the figure. You can see that the floss passes between your teeth and you can remove 80% of the bacteria between your teeth. which your brushing will not remove, which your mouthwash will not remove. So now you understand that flossing is one of the major integral part of oral hygiene care, which everyone should make sure and make it a part of your hygiene. So flossing is necessary, and flossing is a very, very important aspect because it removes the plaque which is not seen to you, which is not seen to anyone. It goes interdentally and clean it. But then make sure that when you're flossing, don't injure your gums. Be careful, be gentle, and floss. That's why the dentist will teach you, help you, reinforce you regarding dental flossing, how you have to do, what are the methods of flossing. And you have got nowadays flosses with holders also are there. So it's very, very easy for you and you can do it at ease. Now, this is also one of the myth, you asked me about this, like placing an aspirin next to your tooth can reduce the toothache. It's actually quite funny. Placing an aspirin means you have a tooth pain and you keep an aspirin and you bite. Maybe a aspirin, maybe a paracetamol. I know aspirin is available over the contour as a painkiller everywhere. It's a very good analgesic, right? But then that doesn't mean that you keep it between your teeth and you bite and you feel that pain is reduced. No. See, aspirin is something, it's an analgesic, but then you have to just think about it, that aspirin, even though you keep it between your teeth, it dissolves because it is most of the time it's a disposable tablet. But how will it penetrate your tooth? Your tooth is made up of enamel, and you will not believe that enamel is the hardest substance of your body, right? So can it penetrate the tooth enamel? No. So aspirin has to be taken orally. That means you have a tablet which dissolves into your bloodstream and then causes relief in pain. So keeping an aspirin next to your tooth or biting between your teeth which are paining is not going to help you out to relieve your tooth pain. My myth number 10, what I have come across is teeth cleaning makes your teeth loose. This is very frequently encountered by most of the dentist friends of mine who are maybe there in the room itself or maybe on live. Yes, teeth cleaning makes your teeth loose is a big myth among all the patients, almost every patient. They say that my teeth will become loose, or maybe I will lose enamel if I come. So this is one of the reason patients justify when we ask them, why don't you come for checkups every 6 monthly or 1 yearly? No, because if I come for checkup, you'll advise cleaning and I will lose my teeth. See, I'm showing you a picture there. So basically, teeth cleaning or scaling, what we call technically as scaling or oral prophylaxis, is basically used to remove the tartar. The tartar, what is there around your teeth. You can see the brown tartar, what is there around your teeth. Tartar is what? Basically, as I said, the bacteria is called as a plaque. That plaque or the bacteria, when you don't remove, will calcify to form tartar. Tartar is a calcified hard. If you actually see your lower front teeth, if you just lower your jaw and you see your lower front teeth towards your tongue surface, you see brownish or maybe yellowish chunks of tartars. What is that exactly? We remove that. We don't remove your enamel. We don't try to pull out your tooth while doing cleaning, right? So it's basically you feel like that during the procedure that something is happening, but then it is not in that way. Teeth cleaning is mandatory. Oral prophylaxis or doing a scaling or getting your scaling done by a dentist is mandatory to everyone 6 months to 1 year for every individual, whether you have a problem or you don't have a problem. The dentist will recommend the maintenance protocol based upon your hygiene, whether you can come yearly once or you have to come 6 monthly one, whether you can come, or maybe you're advised to come 3 monthly also, quarterly also, depending upon the gum condition. And we remove the tartar, we remove the plaque, we don't pull out your teeth won't become mobile. Your teeth are held in the position because of the tartar. When we remove the tartar, it's natural that your teeth are slightly moving. That's a fact. Your teeth are actually moving, but because of the tartar, they're held in the position. And the moment I remove it, you feel that, what happened, doc? My gaps between the teeth have increased. What happened? My teeth are becoming mobile. That's very common when patients complain to us. But that's a myth. It's part of the treatment. The moment we remove, you feel like that for a few days, and then you get adapted to it. We're not creating gaps. Gaps are already existing there. We are only removing so that the gaps are seen. Because you understand what is the position of your gums and you at least get aware about it, and then you undergo the treatment, whatever necessary, or you start doing your cleaning properly. Myth number 11. This is again very important. Treating milk teeth is not important. Now, this picture is slightly technical. If you see, if you're seeing some teeth which are lying below the primary teeth. Now, what teeth you are seeing are the milk teeth, right? Below the milk teeth, you can see some teeth which are half developed, which are trying to come out. Those are your permanent teeth. If you see the picture very, very carefully. Now, most of the individual think that milk teeth are not very important because they are part and parcel of life. They are there, they will go away, right? So yes, they will go away. But then if you don't treat them, what happens? When your milk teeth are not treated, the milk teeth will pass the infection to the underlying permanent teeth, which you are not aware of. The milk tooth infection, if it is causing, suppose you have a decay in a milk tooth, you are thinking, fine, definitely milk tooth is then 1-2 years, the tooth is going to be mobile and the tooth will come out automatically, right? But that sometimes causes infection to your underlying permanent teeth, which is going to erupt after 2 years. And that tooth erupts with some disorder, which we technically called as Turner's hypoplasia or Turner's tooth. That means a permanent tooth which has got some problem. Suppose, and most of them believe that if you have a milk tooth problem, you have to only go for extraction. Just get the tooth removed. You have a problem, you have a small filling, you have a small decay, get the tooth removed. It's a milk tooth anyhow. Permanent is coming, right? Like, so you are not thinking that when we remove the milk teeth, the space what is formed, what about that space? The space what is there when you remove the milk tooth, suppose the permanent tooth is going to erupt after 3 years. 3 years, there is no teeth in a child's mouth. 3 years, what will happen in the mouth? How will the child chew? First of all, they eat little and there's no chance for them to chew properly. First thing. Second thing, it affects speech. And third most important, it affects space. You need to maintain that space because when the tooth is removed, you lose that space and that space is occupied by the other teeth. So where will the permanent teeth come from? There's no place. There's no place for the permanent tooth to erupt. And then in future, we advise you for braces. That's why we advise you for braces, because when you are not correcting it, see, that is why there is something called as preventive orthodontics. There's a specialty in dentistry which looks after only kids, which is called as a pediatric dentistry. They are doctors who look into the milk teeth and they treat milk teeth from the day they erupt from 6 months till adolescence. And they are the doctors who decide whether your milk teeth has to be retained, to be removed, or what exactly has to be done. So my only one thing is make sure that milk teeth, if they are there and you observe in children who have that, they need to be addressed. Because there are a lot of children who are facing from caries, means the decay, which is caused by bottle feeding. Bottle feeding is the most important cause in children for causing decay. Long-term bottle feeding, whole night the child is having a bottle feeding habit. So what happens? The children get multiple decay in their teeth. You would have noticed a lot of children having front teeth decay, lower teeth decay. They have a lot of decays, multiple decays. So all that has to be addressed and avoid bottle feeding for long term. At least make sure that child rinses after that. Because the sugary substance which you add in that is the main cause which causes decay in the primary teeth or your milk teeth. Next most important. Does the outcome of braces treatment is retained whole life? You undergo braces treatment, there's a good braces treatment done, you undergo metallic braces, or you undergo ceramic braces, or maybe Invisalign nowadays, which is called as invisible braces, clear aligners. The treatment will retain whole life if you are a compliant patient. The orthodontist will advise you something called as a retainer. This is what is the picture which shows what a retainer is. So a retainer is something which is always there, which is always placed into your mouth, which is not seen definitely. On your front and your lower teeth backside, a metallic small wire is placed with the cement, with a filling, and that retains the position of the teeth, which an orthodontist has got for you. After so much of struggle of 1.5 to 2 years, which you have undergone, an orthodontist has given attention to you, that spaces which is closed, the gaps which are closed, your teeth are perfectly fine. You have a very good smile, but then you don't undergo retention treatment, everything is vain. You will have to again repeat the whole treatment. So make sure to, if you want to undergo the treatment or the result, what you have achieved with braces, to be retained, you have to follow some protocols and be compliant with your orthodontist and undergo these type of retentive devices which are advised to you. In this also, you have got various varieties, which orthodontist will tell you based upon your situation. It is not the only one, you have got other types of retainers also available. Now, this is something which is very important, that do all the braces treatment require teeth removal? No. a very big no for this. All the treatment, all the braces treatment. Now, most of the people who actually want to get braces treatment also done are always skeptic about it because they think that they are going to pull off my 4 teeth, two upper, two lower, and then it looks bad, right? So it is not necessary that every time you go for braces and every time we advise you to remove four teeth. No. There are conditions when we advise you to remove 4, sometimes 2, sometimes we don't advise you to do it also if you already have space. So basically, your jaws and your teeth spaces, sizes are measured with x-rays and everything, and then a decision is taken whether we have to remove your tooth or not. And mind you, if the tooth is removed also, that is removed basically to close. The treatments are done to close the space. So don't worry about it. If it is a part of your treatment protocol, you have to undergo it. But without undergoing a proper investigation and treatment, I don't think so. You all should be skeptic about undergoing an orthodontic treatment. That means the braces treatment. And this is a very, very popular and a very ancient myth actually. But still, there are some people who still have a doubt upon, does your tooth extraction affect your eyesight? No, it does not affect at all. Your teeth have got a different nerve supply. Your eyes have got a different nerve supply. Your ear has got a different nerve supply. So there's a different nerve supply for every sense organ provided to you. So please, you have to come out of this myth. This is something basic that when we advise you tooth extraction, the next question you ask is, will it affect my eyesight? Is an absolute big no. Never. It will never affect your eyesight. There is entire different nerve supply for that. If you Google also and check, they will tell you a different nerve for eyesight and a different nerve for dentistry. So because most of them believe in Google things, so even that is very clear. There's entire different names, entire different nerve supply for eyesight and your teeth. So don't worry, you can go for tooth extraction whenever advised to you. And then 15th myth, implant surgeries are very risky and painful. As an implantologist and as a gum specialist, I can always say that if it is risky, then this would have not been one of the most modernized branch of dentistry. Implant dentistry has become one of the most advanced branch of dentistry. And it is not painful. Why will be a dental treatment be a painful? Because we are doing it under a local anesthesia. Unless your area where we are planning a surgery is anesthetized totally, we will not proceed with the surgery. And implant surgery is not risky in terms of what risk people think about. Will it go and come out of the jaw? Will it go and insert into your eye? No, it won't happen like that. There's a very stringent protocol which we follow before we plan an implant. We check your bone breadth, we check your height, we check everything. We check where is your nerve, we check where is your sinus. We have so many things we consider. That's why they are specialists for that. How can it be risky? It is, when risky in the sense, the prognosis of the treatment, if it is risky, if we say that the prognosis, you may take up implant or no, then we inform you prior. 0.1% it happens that your body rejects implant. That's only 0.1% risk. But then because an implant is made up of a material called as titanium, which is 100% biocompatible to your body, there is no chance of risk in placing a titanium, because that's the same material which you use for even for any type of a metallic structure which we insert into your body. Not only implant, but anywhere. It could be a stent, it could be a knee replacement screw, it could be anything. And we follow titanium. It's absolute biocompatible. So don't worry about the myth what you have that it's a screw which is kept. It is not a stainless steel screw. It is not a screw what we nail on the walls, right? It's a screw which is made of titanium, securely placed into your jawbone, considering everything, and you will be fine. So it is not risky. It is not a painful procedure. It's an advisable procedure in today's world when you have a missing tooth. Yeah, this is something for some of my friends and some of my geriatric friends, some of my old friends who are actually using dentures or maybe skeptic to use dentures, or who are thinking about dentures. Like, once I receive my dentures, I'm set for life. Yeah. I'm set for life. Okay, I got it, and now like I can be at home forever. I don't need to go to a dentist. My job is done. I got my second set of teeth. And the second myth is, if they undergo, after undergoing, second thing is, some people who have not undergone will think that it will take a lifetime to adjust to my dentures. It's so boring. So why should I go for a denture? I don't know why. But yes, dentures Basically, you have to understand one concept. You all know that our natural teeth, what are there in our mouth, they wear down with time. Eventually, with time, your natural teeth will also get disturbed. So you may get fillings, you may get you may get the above part of the tooth gets attrited. That means it's wash away. You get sensitivity. With age, these things happen. Similarly, these things may also happen with dentures also. You have to understand dentures is a total prosthetic. It's an artificial teeth set which we are giving it to you. Now you just imagine that the tissues, your mouth, your muscles, your oral tissue, the oral tissue and the mouth tissues or your musculature, what is there around your face or your mouth, don't you think they need time to adapt to something new? Don't you think that? You have kept something foreign body, something outside body into your mouth. Don't you think that your mouth, your tongue, your cheeks, your muscles take some time to adapt to it? Yes, they take time to adapt to it, right? So as your teeth are going to get changes or worn out with age, even dentures also get worn out with age. So it is not set for life. See, your jaws, your bone, they also get slightly time. They also get remodeled. There'll be changes in your bone. Maybe some patients may become osteoporotics. Maybe someone gets diabetes. Maybe someone gets some other problem. So they are a frequent changes which happens in old age because of lot of conditions, and that will definitely cause change in your denture size. You may suddenly feel that my denture is becoming loose. That's not embarrassment. Maybe there is some change, because that's how the dentist will do something called as a relining and rebasing. We periodically check and we try to change we don't directly change the whole set of dentures. We try to reline it. You can see the surface of the denture, what you can see in the picture. We reline your denture so that it becomes adaptable to you. So denture needs periodically evaluation, because sometimes if you actually ignore the problems with denture, it may become a big issues later. Maybe some patients may feel sore mouth. Some people may have some irritation at your lip level or something. So you have to get them checked, because see, definitely they are made up of a material. They are a foreign body. They are a prosthetic device which is kept in your mouth. Please give some time for it. Give it time to adapt. And it is not set for life. You have to go for checkups. You have to get them evaluated, and it will 100% get set into your mouth. Give some time. Slowly, eventually, you can. But you can't expect that immediately given denture, you can bite an apple tomorrow morning. It's not possible. Because first, we advise you to start speaking, start putting your tongue movements, start having liquids, something soft. Then you can go ahead with hard objects. But then you can't imagine, it is not a magical device that from tomorrow you can eat everything whatever you want. So you need to get some time for the body to get adapt to something like that. Myth number 18. Does bleaching has a detrimental impact on your teeth? See, initial days, bleaching, when we used to do bleaching or teeth whitening, we used to put acids on your teeth. Don't worry, not an acid what we use for normally for your cleaning, but then we have some acids which we use for in dentistry, and we used to put that used to cause irritation to your teeth, because that used to worn out some enamel and a lot of sensitivity. Today's practice, we don't use as such strong acids. We use more of hydrogen peroxide. We use milder acids, which actually will not penetrate inside, but they allow the light to refract and your teeth start appearing white. So the mechanism is different. The chemicals used are different. They're not that bad what we used before. And there are very, very mild acids, which will actually allow the chemicals, which will interact chemically, and they allow the light or the laser light, what you're going to pass, that light will allow, means the chemical will allow the light to refract through it, and you see a prismatic change on your teeth. So that is what is whitening. So it doesn't cause as detrimental impact on teeth as it used to cause before. How often do we have to visit dentist? This was something very recent I got. Yesterday, someone asked me, like, how often do we have to visit dentist? It is ideally by the FDA, ADA, it is accepted to be 6 months, 6 monthly, half yearly. But then based upon, as I said to you, and I've already mentioned in the before discussions of my facts, that yes, you have to visit a dentist, that's compulsory, but sometimes it could be 3 months based upon the gum disease you are suffering from, sometimes 6 months, sometimes maybe 1 year, but we advise you to come for a checkup every 6 months. The next question which you will ask me, why 6 months? See, because most of the conditions in dental conditions are not having symptoms. So at least if you have a beginning of a disease, we can at least evaluate and we can tell you, yeah, this tooth, we are going to start with small cavity. Just get a filling done. Maybe after 1 year when you come, it may become a big cavity. We never know. And then I may not tell filling, I may go for a root canal. So we cannot see. That is why we always say, maybe I can say, yeah, fine, you have got some interdental gaps here. You can start doing flossing, you can avoid it. But then if you don't listen, so that is, you're not having any symptom, but I am evaluating and giving you my guidance on oral hygiene practices. And 6 visit monthly is not only for doing a treatment always, it's basically reinforcing oral hygiene. Asking you what you are doing, telling you what you are doing. No, brush like this. This is the method. You are doing fine. This is how. So we have some techniques called as disclosing agent, where we put a plaque disclosing. We show you this is how you are brushing. Maybe this 3 teeth you are not touching at all. Then you will be aware. Okay, fine. I should start brushing on that area. So we educate you. Most of the dentists have intraoral cameras. They will just show you on cameras. They will show you. They'll educate you. They'll motivate you. That is why education and motivation is a very important part of a dental consultation, which you all should undergo every 6 monthly. Next, oral health is not connected to rest of my body. It's just a tooth, right? So if you only think that just a tooth, but no, you have got a lot of evidences which prove that it is not only just a tooth, but it's a whole lot of body. It's part of your teeth. It's part of your body, right? Teeth, your mouth is a part of your head. Your head is part of your neck, and neck is part of your body. Don't you think that? Now, these teeth are definitely part of your body, and the gums surrounding them are a very, very integral part of your skin, of your tissue, what is there in your body, and they have a very important role. We have got a lot of evidences which shows that gum diseases can lead to cardiac diseases, can lead to diabetes, can lead to neurological disorders like Alzheimer's, Parkinson's, a lot of things, even pneumonia. For a bedridden patient sometimes goes to aspiration pneumonia. There are a lot of conditions which happen. So don't ignore your oral health. Oral health is a very, very important part, and a very important connectivity is there to your whole overall body. And the more good you keep your oral cavity, the better your overall body will be. And it's actually easy to maintain oral health when compared to your general health, right? So it is in your hand. So you need to make sure that your oral health is totally in control, and you can easily maintain it with regular checkups and evaluation, because there are a lot of evidences which I have already proven its effect on your cardiac system, on your heart. Nowadays, there are a lot of medical professionals who send the patients to dentistry, dental departments, or to a periodontist for screening for cardiac. It also affects even pregnancy. There are a lot of adverse pregnancy outcomes which happen if a mother has a gum disease. If you notice, most of the mothers, most of the women during pregnancy have gum disease. That's all because of the hormonal changes, and that, if untreated, leads to a lot of adverse pregnancy outcomes. So there are a lot of things which happen. So you need to be aware of these things, and you need to make sure that these things are going to help you out to actually understand the association of oral health and overall health. Now, chewing gums is better than brushing. Most of the other part of the world always think that if I'm chewing, I'm done. There is no need to brush. It replaces brushing. See, chewing gums is never a replacement for doing brushing. They basically clean your teeth. They basically aid in promoting your oral health, but then you cannot replace it with your teeth brushing. So we recommend you chewing gums, but then mind you, they are only sugar-free gums which we recommend, not any gum, whatever you like for. So there are sugar-free gums which we recommend. It's basically we recommend as a part of oral physiotherapy. Oral physiotherapy. It basically aids your oral health. How? Because when you chew the gums, which are sugar-free, it basically increases your salivation of your mouth. You salivate more. So when you salivate more, what happens? It flushes the acid which is there in your mouth because of the bacteria. It basically flushes the acid if it is there. It flushes some food particles which is stuck. It basically acts like a lubricant in your mouth. So that's how chewing gums are best source, but then not a replacement for brushing. This is something which we advise as just a promotion for oral health, or maybe to aid in a better oral health, but not as a primary role of replacement of a toothbrushing. Mouthwash usage also is a replacement for brushing. This is also a big no. Any mouthwash cannot replace toothbrushing. You have to understand, And there are over-the-contour mouth rinses available all over the world. People buy gallons of mouthwashes and start rinsing without any doctor's prescription. So mouthwashes are not meant to be used for an individual who doesn't have a dental disease. Okay, you have an occasion, you want to use it, you have a bad breath, you want to use it. Maybe you can use it for a day or two, but then not on a long-term basis. Mouthwashes, few mouthwashes from few of the companies contain alcohol, and alcohol-containing mouthwashes on a long-term basis. They are evidences which have caused cancer in the mouth. They disturb the bacteria, the healthy bacteria in your mouth, which you all know as probiotic bacteria. So even that is also effective. So mouthwashes are not a replacement for brushing. Mouthwashes are advised by the dentist based upon your condition. Better use therapeutic mouth rinses for 15, 20 days, 30 days, and you can stop, because the best option is doing brushing and flossing. So what they will remove, what a floss will remove, a mouthwash will not remove. Mouthwash will just flush off what is there superficial. So mouthwash will basically kill the bacteria, but mouthwash will not remove the tartar. Mouthwash will not remove something what is there, which is hardened enough your tooth surface. So you have to understand that. So those things have to be considered when mouthwashes are there, right? So please don't use over-the-contour available mouthwashes. Wait for the dentist to recommend you if necessary, or sometimes it is not necessary also. And based upon your gum disease or based upon if you have multiple cavities, we give you fluoride-based mouthwashes. Sometimes we give you triclosan-based mouthwashes based upon the tartar. If you're a high tartar former or a low tartar, we say they are mouthwashes for dry mouth. Maybe if you're not aware, there are people who have got dry mouth. Maybe some people have got who have got radiotherapy because of the cancer in your head and neck region. There is no saliva in their mouth, so we give you artificial saliva mouthwash. There are some people who get burning mouth. Most of the elderly women get burning mouth syndrome. They get burning in their tongue and the cheeks. Sometimes we have to give you something which is an analgesic mouthwash or an antihistamine mouthwash. So there are a lot of things are there. A wide spectrum is there, which give a dentist a chance to recommend you based on your condition, and don't use it what is available in the markets. So that was the last myth I could clarify. Maybe this is what all of you have given me, has gathered 22 myths, and then I think I could help you all to solve most of the myths. If anything is there, I am open for discussion. You can put it on the chat box. I have stopped the sharing. Yeah. Any other things are there which you want me to clarify, or what I've mentioned, any other doubts are there, then you can ask me. There are a lot of chat questions which are coming here. Yeah, fine. Why do they make toothbrushes with hard bristles? Yeah, good question. Good question. See, the company initially used to make the brushes with these bristles. Initial means from the day when the bristle started, when the toothbrush manufacturing started, they were only hard, medium, and soft. There was nothing called as ultra soft and sensitive. That is why because older days when the people were not used to use brushes only for brushing. In those days, people used to use very hard stems, especially in Indian culture also. Most of the people use some stems, something to bite and something to clean. So people were always used to use something hard to brush. That is why they were introduced. Today also they are available. They are available for everyone. But then see, if you are even using a hard bristle also, if you brush softly, you can still manage it, because hard bristles and hard brushing, both of them are a problem. Soft bristles are good when we actually indicate someone has gum disease, but ideally medium to soft is always ideal. Do I advise using aqua floss? Yes, there are a lot of water-based flosses, water picks, water flossers available. We do advise water flosses, but again, it is not a replacement for toothbrushing, because water floss will basically flush off the food debris, but not the bacteria. So you have to be very, very clear. Water flosses are available, and water flosses we advise for even older individuals sometimes who have a difficulty or lack of physical dexterity to brush. In those conditions, we advise water flossing. In individuals, sometimes people wearing braces, yes, we advise water flossing, but not as a replacement for your toothbrushing. You can brush regularly, and because now you understood very clear, water flosses are again not removing the bacteria. They are only removing the food debris, what is get stuck between your teeth sometimes. If is there a cure for receding gums? Can they be pulled up, receding gums? Yes, ma'am. There are cure for receding gums, but then it's actually a big discussion to actually and it purely belongs to my specialty. So I would love to answer that question. Receding gums depends upon how many teeth the gums are receding. First thing, whether it is one tooth, two teeth, or maybe all the teeth. That is one thing. And if it is, and if you are able to visit to a dentist when a very initial stage of receding gums, yes, it can be treated up. It can be treated, but there are a lot of things which we do. But it's a surgical intervention. We will try to pull the gum up. Third thing is we do fillings to replace your gum. We have got white fillings. Sometimes we have got pink fillings also. And the fourth thing is something called as party gums, if you have heard of it. There are a lot of people who get 8 to 9 teeth, they don't have, the gums are receded, and you feel embarrassing because the moment you smile, there is no gum seen, only teeth are seen. So we give you something called as a party gum. Party gum is something, it's an artificial gums which you wear on your teeth. And maybe most of them are not aware about it, but that's called as party gum. And it will be so interesting that someone feels that you are having such a good smile, but it's actually an artificial gum what you're wearing. And then, so that is what is available. So it depends upon what stage and depending upon factors, we decide what can we do. But yes, receding gums can be managed based upon person to person's perception about the care of gums. Yeah, if wisdom tooth has not come, is it necessary to be extracted? Yes, Miss Hajira, wisdom teeth are, yeah, it is actually one of the myth which I missed out maybe, but because thank you for at least asking about wisdom teeth. Wisdom teeth have not erupted. There is no need to remove it unless, see, that's what I'm telling you. When you come for a 6-month checkup for a dentist, he will take an X-ray and tell you whether you have wisdom tooth or not, because you don't know whether wisdom tooth is there or not. Sometimes the wisdom teeth are totally inside the jaw. When they are totally inside the jaw, the dentist will check in an X-ray and tell you whether this tooth is going to erupt or no, whether it is going to trouble you or no. Because keeping a wisdom tooth in your mouth maybe for years, sometimes it happens that it may form a cyst. The tooth will have a cyst surrounding it. So that becomes a big problem. So you have to take care about that also. So wisdom teeth, unless you go for checking by a dentist, they decide whether it has to be removed or no. But if it is too much embedded deep into your bone and is not causing you any problem from long term, then better not to get extracted. But the moment we see some changes in your X-ray, then definitely it is great to extract. Don't wait for the pain to happen, because pain is something when it starts and it will trouble you a lot. So once it is partially erupted, it will trouble you. So better get it extracted before it shows you the actual symptoms. Is cheek biting due to health? Okay, is cheek biting due to teeth problem? Yes, ma'am. Teeth biting is due to teeth problem. Yeah. Cheek biting happens because of the wisdom tooth itself. Sometimes there's a wisdom tooth and you bite, the upper and the lower wisdom teeth merge each other, your cheek comes in between, you get a bad cheek bite. Most of the young individuals from you can take from 18 to 30 years of age, when the wisdom teeth tries to erupt, this is what happens, that you start biting your cheek. So you don't have complaint of wisdom tooth, you come to us with cheek bite, and the moment you open the mouth, we see a small wisdom tooth is trying to pull out because there is no place. So you get cheek biting, you get ulcers, you get a lot of issues. So yes, cheek biting happens because of wisdom teeth. Second thing, cheek biting can also happen if your one of the tooth structure is having some sharp point. So that also is one of the reasons why cheek biting happens. Flossing is not easy. Is there a method to this? Yes, ma'am. Flossing, yeah, there is something called as floss with a holder, which I may share with you in a personal window, like how exactly we can do it, and I'll share you what exactly I'm talking about and how exactly we can use it, which will be a very easy method for you to use floss. Because I know the conventional way of floss and tying it on both the hands and putting it this way, that way, it's a little difficult. But nowadays we have got floss with holder. So if you are in India, then I can tell you which brand flosses with holders are available. You can definitely procure it. If you are abroad, then also I can let you know what brands are there and a very easy method to use it. I may demonstrate to you. what is a water floss? Water floss, yeah, water floss. Water floss also something which I will definitely share with you, ma'am. Water floss is something which will have a small, you can say like a small brush, not a brush, maybe a small this thing, and you have a water container below that tube. The moment you press the button, the water which is there in the container will flush onto the teeth. And that small bottle you can mix with the antimicrobial solution or a mouthwash. And there's a small tube and it has got a nozzle. The moment you press the nozzle, the water from that container comes out and it flushes your teeth. It's an excellent way of maintaining it, especially for implants, especially for a lot of conditions. It is a very good mode of hygiene. I will send you a link where you can definitely this one buy that, because it's available online. I will share the link with you. You can definitely procure it, and then I'll help you out personally to use it and what chemicals you can mix in it for your hygiene. Definitely, it would be a pleasure to help you for that. Normally, for tooth pain, they apply clove oil and zinda talisman. Is there a visit to doctor? Do you suggest if this can be applied? No, ma'am. No, 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 no. So it is the same thing which I cleared regarding aspirin also. Aspirin something is aspirin also same thing. Zinda, see, there is zinda talisman and all these products. You apply them intraorally and all. They cause a lot of allergic reactions sometimes into your mouth, into your gum. So we don't advise. See, these are all to be applied topically on the skin. You have headache, you apply. You have a body ache, you apply. You have it is basically having absorption on skin topically. It is not to be taken, and it causes detrimental effects on your gums, on your teeth, on your tongue also. Sometimes patient comes with some other problem. They apply it today, they find comfortable next day morning, but they'll end up in some other issue. And then we have to pull out the history that what did you apply, what did you apply. Then they tell they applied something like this. So don't apply those things. People also apply sometimes all this painkiller gels and all. Other than this, the allopathic one also in the oral cavity, but that is not a good choice. How often should we floss? Yeah, you should floss at least once a day. At least once a day. Twice is very good. At least once a day is definitely advisable. At least once a day is definitely advisable. You can floss at least once a day, and you can definitely maintain the hygiene based on that. And I think that should be fine. Anything else is there? You can have an open discussion.
I think that has been an amazing session, Dr. Ashank. And I wish that this is the first part of our series of the 3 talks, and the first one itself has been a very informative one. And if there are any other questions, we'll be there for another 30 seconds to 60 seconds to
yeah, anything is there. Yeah.
One of the myths which always people have is not asking the myth to the dentist himself. So I think that is the first thing which needs to be demystified. That if you have a doubt, please go.
I know. They don't ask. They don't ask. Either they don't ask, or they ask, or they see. There are 2 ways. Either they very subtly ask us because they know maybe the reaction of a dentist could be something disastrous, or maybe they ask their colleagues or their buddies or maybe their friends that this is how I went to a dentist and I feel that this is what can happen, and shall I go ahead with that? So that fellow says that yeah, no problem. Even I have that same thing. You clarify with him. So those things definitely happen, and I would definitely advise that please ask your dentist. Don't be hesitant to ask your dentist, because see, if you are confident in getting the treatment done, it will be really helpful for us to do a treatment for you. So you better ask, or at least it will be very clear and frank, because we know that 50% of the patients are having a mindset of a lot of anxiety. More than myths, it's basically the anxiety which leads to myth.
Yes.
They're very, very anxious. So I think that disturbs them a lot. And please, one more thing, dentistry is not a painful procedure. And second most important thing, dentistry is not expensive. The dental ignorance is expensive.
Another myth is that many people fail to understand that dentistry itself is a very big domain, and it is a very large genre, and there are many specialities inside the dental study also. And a common myth is that if you have any kind of a toothache, you could just walk into any dentist who is a normal graduate. Although that's a good option, but if you could shed some light, as to broadly which are the 4 or 5 domains of dentistry,
See,
and people could gauge as to which one to
sure,
visit.
sure. That definitely. I'll just segregate or maybe just give you some information. In dentistry, we have got normally 9 specialties which we are dealing with. But then when we talk about pain in dentistry, someone and pain and a tooth pain is something which is, I think most of them have undergone. It is the most pathetic pain anyone can undergo, and it's uncontrollable pain. So first thing a patient does normally is going to a pharmacy and taking a paracetamol or a simple painkiller, which is wrong. And even he gives it also. Just take it for 2 days and finish it off. That is first thing. Second thing is a general dentist can definitely help you out to at least rule out what the pain is due to. It is a decay or it is a wisdom tooth. So emergency pain is always dealt by any dentist, which I can proudly say. Even a general dentist can rule out an emergency pain. If you want to undergo a root canal, it is always an endodontist who are specifically responsible to do a root canal treatment. Everyone can do it, but a specialist is an endodontist who is a root canal specialist. You want a crown above that because you do a root canal or you have a missing teeth, you have to go to someone called as a prosthodontist. He is a specialist for crowns. Then you have gum specialists like me. We are called as periodontists. We treat all your gums, receding gums, bleeding gums, bad breath, flap surgeries, a lot of things with gums. Save your teeth, basically. We are the people who save your teeth. You want to go for an impaction, you have a wisdom tooth problem, you have to go to an oral surgeon. You have a specialty called as oral surgeon. For braces, you have got a separate specialist, as you all know. You have oral physicians also nowadays. You have got oral radiologists also who evaluate your scans. So nowadays, all the specialties have got their own edges over others. So it's basically a patient call whether he walks in or what exactly he demands. And every dentist, I'm sure, will provide you the specialist whatever you want. Even though everyone can do everything, but then they will provide you anything. But the only thing is the patient should be specific on what they ask. And maybe there are a lot of things that, and especially like for kids, you have got pediatric dentists, you have a separate dentist for that. But now we have got a lot of other specialties in dentistry, like implant dentistry, sports dentistry. There are a lot of children who are getting injuries. We provide you mouth guards for your sports to prevent sports injury. So there's called sports dentistry. You have got forensic dentistry. There are a lot of things which are coming up for forensics also, where a dentist plays a very important role in recognizing the forensic part of it. So forensic dentistry has also come up into that. So a lot of things. Oral physiotherapy. Dentist as a physiotherapist has also, because there are a lot of problems which are coming up with the joint issues. So even that is also playing a very important role. So everyone is there. Only thing is, it's your mindset and the patients make up what he wants to, and then I think most of them will provide you the best service possible. Otherwise, we are there. You can anytime ask us who is the right person to go.
I think our next topic is going to be about specific diseases and aging, like Parkinson's, diabetes. Although that's a separate topic which will be dealt.
Yes.
But one of the myth before we leave today is a myth that is there is that, oh, you know what, I have high sugar and I have high sugar values, and already the wounds in my legs are not healing. And on top of that, if I go and get a dental surgery or do anything to my teeth, the healing will be very slow, or it may lead to some other problem. That's also a big myth with sugar healing and
see, diabetes.
Yeah,
I totally agree that diabetes or a high sugar has got a big impact on dentistry. High sugar, when mostly as gum specialist, we can always or normally when we extract the teeth also, we always make sure that you have to get your sugar level estimated before we plan any surgery in your mouth. Yes, if your sugar level is high, it will impact on your healing. What heals maybe in 20 days may heal in 40 days. You may have immunosuppression, you may have a lot of issues. It as a sugar patient will have its impact on a diabetic foot or a gangrene or anything. It will have also on the oral cavity and any oral disorder. And maybe in my third session, I will specifically talk about what are the conditions in the mouth which you will notice when you are a diabetic patient. Or maybe sometimes as a periodontist, we diagnose diabetes. When patient is undiagnosed diabetes, seeing the gums, there are a lot of things which happen in the gums which will give us an indication that patient could be diabetic, and we immediately send the patient for a diabetic evaluation and he turns out to be a diabetic. Then he has to go to diabetologist, get treated and come back to us. So there are a lot of things which have come up now, and I will talk about in detail care and precautions for a diabetic individual.
So if you could just shed some light before we close the session as to what is going to be the second session and what's going to be the third session, so that people are well aware of that and get hooked up.
Second session, yeah, sure, definitely. First of all, I should thank the organizing team of DOBARA to give me an opportunity to conduct a second and third session. First thing. And second session is something we are going to talk about. Something very, very important is about the management of neurological disorders or neurodeficit problem or a neurodegenerative issues like Parkinson's disease and Alzheimer's disease. These are the two neurological problems which most of the people are facing today all over the globe. And there is a lot of, I should not say myth, but there's a lot of lacuna in understanding of the oral hygiene care which I need to give to the caregivers in the management of Alzheimer's and Parkinson's patient at every grade of patients, at the diagnosis level, what they can undergo, at a bedridden level, what they can undergo, what a caregiver can do. And maybe I would also like to share some light on even a dentist also, if the general dentist or the dentist who will be part of of this presentation, at what as a dentist you can do when a Parkinson patient walks in, what precautions you can take, what drug interactions you can take. And then I think it will be a great session talking about neurodegenerative disorders and their problems. And third session will be geriatric dentistry, means what are the age related changes seen and in the oral cavity, in the gums, in the teeth, and how do we maintain the changes, what are the options they have for replacement of teeth, and how can they maintain oral hygiene if they're not able to even raise their hand to brush, who don't have a physical dexterity to brush. What about the power brushes, automatic brushes, and so many things are there. So I will talk about that also. And in that way includes even diabetes, and maybe if any other oral hygiene things, or maybe any other systemic conditions are there, maybe osteoporosis also. There are a lot of patients with osteoporosis who have a frequent problem of loose dentures. So that is something like that. So I'll talk about that also. So anything is there, you can just give me a mail or a message. I will add all those things in the second and third based upon the category of presentation.
Another question which was asked, which you left unanswered, is somebody asked, where can they see you in person for a checkup in Hyderabad? Or where's your clinic? Is that? Yeah.
My clinic is at Himayat Nagar, Hyderabad.
So
my contact details can be, I think the organizing, whoever has asked, I'm sorry, I just missed your question. I think the organizing committee can give the details about me or my clinic. I think you can approach me anytime. Even to clarify myths also, I would be more than welcome. It is not that after the presentation, I will not clarify anyone's myths. So it's open anytime, and I will not feel anything for that. It's okay, because dentistry has become something which is actually giving a lot of impact on well-being of an individual, physically, mentally, and socially also. So it's okay. I'm open to all the myths anytime, and it will be there. But anyhow, I'm practicing in Hyderabad.
Thank you so much, Dr. Ashank, and thank you so much, Mateen ma'am and Salim, for organizing this. Hope to see you next week.
Sure, definitely.
Take care and keep brushing.
Thank you. Yeah. Thank you. Keep smiling, all of you. Keep smiling. Okay. Bye-bye. Thank you. Bye-bye.